Hello, hello. Welcome to this episode of the Rogers Radio Podcast. I am your host, Alyssa Rogers, and today we are at the beautiful Southern Plenty in downtown South Boston with these two individuals, Kim Murray and Joel Coates with First Care at Home. I'm so excited to share with you all everything that they offer. I know that you've seen their rebrand recently, and we're going to get into it. Thank you for being here today.
Thank you.
Yes. And so First Care at Home. Kim, tell us a little bit about First Care at Home and the services that are provided and kind of what's been going on lately.
Well, I guess I'd like to start off with telling you a little bit about our history. First Care at Home was actually Commonwealth Home Health, started back in 1985 by Al Burkholder and run by his son, Lee Burkholder, who was our administrator for many years. He is a veteran and he has since passed, and now our administrator is his son, Trey Burkholder, and we have 3 service lines. We have home health, we have personal home care, and we also have now hospice, which is brand new, and I'm the director of hospice there. Hospice has been going on for about a year now, and we are very excited to be providing this service full of heart to our community, and that's very important to us. The other service lines, personal care and home health, actually service 14 counties in the state of Virginia. We have personal care as well as home health here in South Boston that services surrounding counties. We have personal care in South Hill that services counties more in that area. And then we have personal care as well as home health in the Lynchburg area that service counties and meet us in Campbell County as well. So we have a very wide service area for home health and personal care. With hospice being brand new, right now we are servicing 4 counties surrounding 3 surrounding Halifax County, and hope to extend that as our business grows. But I guess one of the most important things we want to get across to people is with our rebranding, it is First Care at Home that we're providing this care at home. And our symbol, our icon, is a heart with 3 roots, representing Al Burkholder, Lee Burkholder, and now Trey Burkholder. And the heart, I guess, representing, who we are as a company, that we have the heart to service others.
That is amazing and, very community-based. And take us through. So you said personal care, home health, and hospice. So let's start with personal care. What does that mean?
Personal care is a company that is provided through Medicaid or someone that would have long-term care insurance and also private pay. And that is more or less nurses' aides, sitters that can come into the home, depending on what the patient qualifies for. And they come into the home and stay for a certain number of hours, can provide ADLs, which can include bathing, washing the hair, helping them get dressed for the day, helping them with position change or getting up in a chair or, walking to wherever they're going to reside for a while. They can fix small meals and do light housework, just depending on what their hours qualify for, and help with toileting needs as well and feeding.
That's a huge help to caregivers and, to families that just, they want their family members to stay at home and they work, and so they will come in and they'll work with the schedule of the...
Pretty much, whatever they can provide for, we try to find someone that can meet the needs, to the best of our ability of the families and the hours that they need. And sometimes you overlap and may need more than one aide to step in and help out, but it is a huge benefit to the families and the caregivers, especially when they're not physically capable to do that. It can provide a huge relief, and a need that is there and that's widespread across the world.
Okay. Home health. What is offered through home health?
Home health has a vast set of skills that they cover, mainly nursing, but also they have a therapy service line as well that provides for speech therapy, occupational therapy, physical therapy, which is wonderful for patients who, have had some type of debilitating disease where they're just generally weak coming out of the hospital or coming out of rehab, who have had joint replacements, hip replacements, knee replacements, who have had strokes, who, have other debilitating needs or illnesses that have affected their mobility in some way, shape, or form, or their ability to function and provide for themselves. So the therapies can get in there and, teach the patient themselves how to do certain exercises and things that they can do in their own time, but they also work with them to do them when they go. They also teach the family and caregivers how to work with the patients as well, and how to safely perform the exercises and the activities that help them progress and improve. And safety measures. It's huge, a huge amount of safety measures involved when you have someone that has limitations. And therapy, all the staff really, are well versed in educating the families on safety, but especially with mobility issues, our therapy line is very well versed at educating the patient and the family on safety and performing the exercises that they need to do to progress. There's also the nursing aspect of home health, which is huge, and they can go into the home, provide education, do medication review, educate the family and the patient on medications, help assess what the needs are, really. In general, sometimes we just need a nurse to go in initially to kind of assess what the situation is, where the patient and the family is, and, see what the needs are. And they create a care plan individualized to that patient and what their needs are, and can pull in therapies and other, aides, which can come in, a few times a week to help with a bath while we're trying to get this patient stronger, or educate the family and teach the families how to take over. We do IV therapy, we do wound care, we do lab draws, medication education, of that sort. It's quite a vast array of skills that the nurses can provide and educate the families and caregivers and the patients on.
How amazing is that? I mean, this is all in the comfort of the patient's home. And so it's just so nice to know that they have someone coming and they're going to help and get them up and going again to where they can operate in their home like they did before all of that. So, hospice. It's new. It's a new service. Been about a year, you said, and I want everyone watching and listening to know I'm excited to talk about this. And you don't often hear people excited to talk about hospice, but we were talking before we started about how it doesn't have to be scary, and I want to kind of talk through that with everyone.
She's right. It doesn't have to be scary, but it is. It is for most people. And we try to make it as I guess, we try to help as much as we can. And I guess that's what I want to get across to people, that First Care at Home Hospice, we've been going on for about a year now, and I know all of my staff very well. And I guess one of the most important aspects that I see is that we have a heart to service other people, that we have a heart to help families through this. And I never in a million years thought I would work in hospice until I lived through it with my own mother 2 years ago. And the hospice stepped in, and I guess I was the hardest one to deal with, but they managed to get me where I needed to be to accept the fact that, my mom was ready to go. She was ready, but I wasn't, but they helped me get there, and that was tremendous, and I will never forget that. And that is very important that we provide that for other families. We give them the education on what to expect, what's coming down the pipes. We like to be able to come in ahead of time. As soon as a patient or a family, they know that this patient is not going to choose any active treatment, any active cure for their disease process, and that the doctor expects that they have 6 months or less. It is, I think, perceived by, the community in general that when patients go on hospice, they are expected to die right away, and that's not the case. We can come 6 months ahead, and we have quite a few patients that live past that. But we have such a benefit to offer these patients. The hospice benefit can provide for comfort medications, and we do try actively to get a patient to the point where they are much more comfortable so that they can enjoy the time that they have left, so that the family can enjoy them, being with them for the time that they have left. We provide for equipment needs, hospital bed, walkers, wheelchairs, Hoyer lifts. We educate the family. We come into the home. We have aides that help with baths. We educate the families on how to provide care, on how to assist the patient with medication management to help keep them comfortable so that they can enjoy the time they have left. We also have a chaplain that can come into the home and, provide education on, whatever their faith base is, to pray with them, to, help guide them, or just to be there with them at times, and to be there for the family at times when they need extra prayer. We also have, I mentioned the aides with the bathing. We also have social worker, and the social worker has a very wide span of education that can provide for the family. They can assist with FMLA paperwork. They can assist families with, guiding them through, the insurance process. They can assist families with obtaining what's called a UAI through social services to help get them qualified for placement if the family is not able to care for them when they become more when they have a higher need, when they're total care and need bed baths and turning. And if the family's unable to provide that, we can help them find placement and still provide hospice care in those facilities as well. We do have nurses that go into the home that assess the patients, that help families and educate them along the way as far as the dying process, as far as feeding, as far as keeping the patient comfortable. It's just a lot that we can provide along the way, and the social workers as well have just quite a knowledge of resources, community resources that are available, and help families do busy work that can be bothersome, stressful paperwork, and they can help complete that for the families so that they can spend that time with their loved one who they're possibly losing, slowly, quickly. But we want them to be able to have that time. So we try to help with, as much as we can in those needs as well. And we also have volunteers, and that's where Jules' expertise comes in. She is our volunteer coordinator, and I would love for her to share with you all about what the volunteers can provide.
Yeah, and this all started because I went to the Spring Fling downtown South Boston. So everyone knows they're everywhere and they're very community involved. So I saw you at the Spring Fling and you were asking for volunteers, hospice volunteers, and you were talking about that. And I was so intrigued when we had that conversation because I had no idea that that was a need in our community. So I want to talk about the hospice volunteers and what that program looks like and kind of what is involved in that.
Okay. We try to network and find people, men, yes, women, 18 years and above. I even have some elderly people working with us, but we take their skills and we train them. First of all, they do a background check, okay, and to make sure that they're safe to go into the homes. And then we fill out an actual employee application because they're basically our employees, even though they don't get paid. They don't get paid because they're priceless. We could never pay them for what all they do.
That's powerful.
Yes, it is. And once they're trained, I find out what their personality is like and how I can connect them with the right family. And our ideal would be to have multiple, 8 to 10 people in every county that could go whenever a need is there, to go in the home, maybe read scripture to someone that hasn't been able to hold their Bible, write letters for family members that from the patient, but for the family after. So when after they pass, these letters can be given to them. Play music, sit and hold their hand, watch a TV show together. If they don't want to talk, if they just, maybe the caregiver needs a moment. Maybe they need a dentist appointment, and so the volunteer is capable of sitting there with them while the caregiver runs to the dentist or runs and makes an errand. And then we have this 2 other programs called Tuck-In Program and the mailing of encouragement cards. The Tuck-In Program is where right now I'm doing it. I'm looking for a volunteer that would be able to do this for me once I train them. But we call between 4 and 6 on Thursday afternoon and check to see, do they have any questions for the nurse? Do they have any questions with the equipment they have? Or any of their medicine needs refills? Now, our nurses are very on top of everything, and I cannot say that enough. Usually, and most of the time, there are no needs. No, I have no needs, but thanks for calling. And sometimes they'll not even answer the phone. I'll tell them, if you see it's my number and you don't need anything, you don't have to answer. But we call and ask, and then if I do see any needs, maybe they're fixing to run out of something that they didn't think they were going to run out of, then I can let the nurse know that night and the next morning, and the nurse takes care of it on Friday, so they have a clean weekend.
Wow.
And then we have a volunteer that does the mailing of encouragement cards. She has taken this on as a ministry, and I've got another lady training to do it because we're getting so many hospice patients right now. And when the patient gets the card, they open them up, and it's like 3D. It's like butterflies or flowers. One time she had one that had a little helicopter for a gentleman that just loved helicopters. So you never know what that little card, getting it in the mail, means. And we need people to do those type of things.
Yes.
Yes.
And so what does it look like? You do a background check, and then how long is that process through background check to actually being able to help patients?
Okay. The background check sometimes can take up to 3 weeks.
Okay.
Usually it's back within a week to 10 days, but sometimes they do get backed up there. We do that first of all before we even start the educational part, because if the background check does not pan out, then we can't use them, or I can use them in some other way, not going into a home. So then we have 12 to 16 hours of training. The training can be done online. And so if you have your personal computer, you can just, my supervisor, Kim, sends that in the know knowledge, and they pull that up on their computer, and they might have an hour class today or a 30-minute class, another day. But it takes 12 to 16 hours to complete all of the work that we need them to know. We need them to know about the HIPAA violations, and not to say anything like if you're at the grocery store and somebody comes up, oh, where were you yesterday afternoon? You can, say, I was working with my volunteer program, but you can't say the name of the person you were working with. Things like that. And just teaching them hand washing and vital things that's important. Safety, like if you pull up and you don't feel comfortable, things to do. And then they always, I meet with them and find out their personality, connect it with the right person, and then I go with them on the first 3 visits until they, the volunteer and the hospice patient and their family feels comfortable with them. And every now and then it may not be the perfect fit. We can change it out. We can fix it. But we want to let the patient and the caregiver know that we are there if they need us.
That is so amazing. I'm still so intrigued by this. I hope if you're watching or listening that you want to get involved in this. And if you do, want to get involved in this, how do they reach out?
Okay, first of all, you can call First Care at Home, 434-572-0063. And usually Jerry, our perfect person that answers all our questions most of the time, if I have any anyway, she answers the phone. And if not, one of our caring staff will. And get your name, address, and phone number, and she will get it to me, and I will get you an application. You fill out the application, and then you send it in, and we start the background process. If you want me to answer more questions, feel free to call, and I'll set up a time to meet with you one-on-one and talk about it to see what you have to offer. I have some ladies that are making bereavement pillows. And what they do is after a patient passes, the family saves nightgowns, shirts, some type of clothing, and then the volunteer in their home can sew the pillows, and then we take those back to the family.
So nice.
So it's really sweet. And so that helps them to give as a volunteer, and yet helps First Care at Home to feel like we're taking care of the whole family the whole way, you know.
You know, what I've gathered through this entire discussion is you don't have to be alone. The families do not have to go through this alone. The patients don't have to go through this alone. And that's all of the services you provide. No matter what you're going through in life, if you need some extra help or you feel overwhelmed because you're a caregiver for a family member, there are people out there that can help and really have the heart to help and make sure that they're as comfortable as possible. So everyone listening and watching, you are not alone, and there is help out there. And you guys will also be at the Walk for Hope this Saturday.
Absolutely.
So if you want to come up and talk to them, I know you guys will have a table set up, and you can get more information there. And I know that they don't have to, do it in a public setting, and that you guys will sit down with them and make sure everything is covered.
Absolutely.
Yeah.
Please don't hesitate to contact us, or you can stop by the office anytime. It's 425 Main Street in downtown South Boston.
Yes, and this week is also Skilled Nursing Week, so thank you to all the nurses out there that are providing these services and helping patients be comfortable. And I just appreciate what the two of you do so much. I know that it can be very difficult at times, but it's all for the greater good of the patients and the families. So thank you so much.
Absolutely, and we thank you for having us.
Yeah,
Yes, thank you very
absolutely. Absolutely. Thank you, everyone, for watching and listening to this episode of the Rogers Radio podcast. Be sure to give First Care at Home a call. They will help you. And I can't wait to talk to you next week.